afternoon. So today I'm going to demonstrate how to perform physical examination of a newborn baby. Okay, so we are just from delivering this baby for Mary. Okay, so we've already explained the procedure to the mother and she has given consent. Okay, so now we'll start demonstrating this procedure. Remember to wear gloves because this baby, you might find that there is blood, there is meconium and the like, so you need to wear clean gloves. So this is a clean procedure. Okay, so some of the things that we're going to put into consideration is you need to make sure that the room that you are doing this procedure is well lit. Okay, you need to close the windows nearby. You need to make sure that this room is well enough so that you don't this baby doesn't go into hypothermia. Okay, so now this is the baby for Mary, the one that we are doing the physical examination. Okay, so physical examination, this is just the examination to rule out any abnormalities from normal. It is a very long procedure, so we'll do the specifics. Okay, so this is the baby for Mary. Okay, come closer. So when you are doing this procedure, they'll ask you in OSCE to say maybe you can just examine the head or maybe the chest or anything. You cannot do the whole procedure because it's a very long procedure. So in this case, we'll start with the head. Okay, so for learning purposes, I'll lift the baby like this. So the first thing that we are going to note is the sutures. So we have this coronal suture here. Okay, we have the frontal bones, the two parietal bones. Then we also have the sagittal suture here, and the other suture here down here. This other suture here, which is the lambdoidal suture. Okay, so we have the coronary suture, we have the sagittal suture, we also have the lambdoidal. Okay, so this baby has two spots, which are called the soft spots. So this first spot here is called the bregma spot. Okay, it's the bregma or the fontanelle, the frontal fontanelle spot. Okay, then this other spot here is also called the lambda. Okay, the occipital fontanelle. Okay, so this one will go on its own after 9 months. As the baby is growing, it will also go on its own. Then this one, it will go after 18 months. Okay, so now the other thing that you need to note is bulging of the the soft spots. If you find that you press here, you find that it's bulging or it is depressed, it is a sign of infection. Okay, so the other thing that you need to note when you are examining the head of the baby is the cephalohematoma. So cephalohematoma is just a collection of blood. So it can either be here, it cannot go on the other side of the bone. So if it is here, it will just be here. So cephalohematoma, like I said, is just the collection of blood. Okay, so you can report to the in charge either there is cephalohematoma or not. Then the other thing that you need to note is the caput suddenum. Okay, so caput suddenum is where maybe the passage it was small, then the baby is born with maybe a head, something like a head sore. Okay, so all that you need to note. Then the other thing that you need to note is, are these sutures overriding or overlapping? These sutures, are they overriding or are they overlapping? Okay, so those are some of the things that you need to note when you are doing a physical examination of the head of a newborn baby. Then the other thing that you also need to note is the circumference, the head circumference of the baby. So normal circumference head of the baby is supposed to be 33 to 37 centimeters. Okay, that's the normal head circumference of a newborn baby. Okay, so those are just some of the things that you need to look at when you're doing the physical examination of the head. Then we'll go to the face. So when you are dealing with the face, okay, you find that this is the baby that is just from being born. Okay, you find that the eyes are closed. We don't advise to start opening the eyes. Okay, what you can do is you can just switch off the light or you can use a dim light. So you find that this baby will open the eyes on its own. Okay, so now what are we looking for in the eyes, or what are we examining? So what we're examining in the eyes is we are looking at the number of pupils. How many pupils is this child born with? There's a condition what we call polyuria. Okay, so polyuria is a condition where the baby is born with more than one pupil. Okay, we're also going to look at the discharge, that discharge from the eyes. Okay, then the other thing is we're going to look at the symmetry. Okay, we're going to look at the symmetry of the eyes. You don't expect a newborn baby to be born to have an eye here. So we're also going to look at the symmetry of the eyes. Okay, so the other thing again that you need to note is the ears. The ears here. Is there any discharge? Is this baby born with attached skin to the ears here, the pinnacle? the pinna here, is it attached to the skin? Okay, you also need to check for any discharge from the ears there. Okay, so that's about the ears, and you also need to know that they're supposed to be in line with the eyes, like this. Okay, there are cases where a child is born without one ear, so all those you need to note. Okay, so from here now you come to the nostrils, and let me point it to say every time when you are doing this procedure you must have a penguin sucker, okay, for sucking either secretions or anything, especially for babies that were born with a cesarean section. It is very important that you have a penguin sucker every time when you are doing this procedure. So now you come to the nose, you check if there is any discharge coming out from the nose. So if there are secretions, that's why now you use the penguin sucker. Remember, the penguin sucker, you start using it with the mouth, which has a larger cavity. So you suck the mouth first, then coming to the nostrils. Okay, so now we'll come to the lips here, the mouth. So here, what are we checking? We are checking the tongue. Is this baby having a tongue? Some babies are born without tongue. There are those things, those disabilities. The other thing is the cleft palate. Okay, you check. Okay, so from here now you've examined the head. So in OSCE you'll be asked to examine the head. You cannot do this whole procedure because it's a very long procedure. Okay, so now we've examined the head, the eyes, the nose, and the ears. And one thing that you also need to note is the face of the baby. Sometimes you find that the other side is long, the other side is short. Okay, so which can symbolize that there is a facial paralysis, or maybe when the baby was being born, there was some birth injury that happened. Okay, so from here now, so we are going to expose the baby for learning purposes. Okay, for learning purposes, we expose the baby. So now here you can come to the hands. So this baby has two hands, as you can see. Okay, so now what are we looking for? Okay, so on the hands we are looking at the symmetry, okay, of the hands. Number two, we are looking at the fingers. How many fingers does this baby have? Okay, so here there is 1, 2, 3, 4 up to 5, and here 5. So in a case where you find that there is an extra digit, you need to check, is there a bone there? If there is a bone there, it means that this child will need to go under surgery so that they can cut the extra digit. If it's just flesh, you can just tie. Eventually, as time goes on, it will come out on its own. Okay, so you also need to check for the symmetry, like I mentioned. You can also check for the fingers, the fingernails there. Okay, the nail beds, you can check for cyanosis. Okay, so now that's about the hands. So for the hands, you check about the symmetry. You also check the extra digits, which is a polydactyl. If a child is born with extra digits, either 6 or 7, it is called polydactyl. Okay, so you take note of the polydactyl. From here now you come to the chest. Okay, so here you can also use a measuring tape. Remember, when we are starting this procedure, we started with the head circumference. Okay, so every time for a newborn baby, the head circumference of the baby is supposed to be larger than that of the chest. So the normal head circumference is supposed to be 33 to 37 centimeters. Some they say 36. So here you are going to measure the chest circumference of this baby. So the normal chest circumference of this baby is supposed to be 30 to 33 or 34. Okay, so you are supposed to measure. Then now you come to the breast here. You also need to check for the nipples and the alignment of the nipples. Okay, so in this case, this baby is okay. The nipples are aligned. Okay, so now from here now you come to the legs. Okay, so from here you come to the legs. So from the legs here, you check for extra digits as well. Is there a polydactyl here? Is there an extra digits here? Okay, so you check. So in this case, this baby is okay, has 10 fingers, so it's okay. This baby is normal. The legs are normal. You also check for the symmetry of the legs. Okay, so at this point now, I will check for the Outlands test. So this is the dummy. Otherwise, you are supposed to check for the Outlands test, where you are checking for the hip dislocation. So when you do this, it's what we call an Outlands test, where you test for the hip dislocation. Okay, so from here now, we've checked about the symmetry of the legs, the extra digits of the legs, and we've also done Outlands test. Okay, so from here now, allow me to remove this this napkin. Okay, so that we learn. Okay. So for learning purposes, I will expose the baby. So from here now, what we are going to look at is the 1% here. Okay, so the 1% here, if it's for the baby, for the female, okay, you need to check for the clitoris and the labia majora. Most of the times you find that the labia majoras are the ones that are protruding most of the times. And you also need to check for pseudo menstruation, which is normal in the first 1 week, but if it continues, then you have to report. Okay, it's either maybe this child is menstruating, which is a fake menstruating, because of the hormones that are still running in the baby's body. Okay, so now you have to check for that. Then from here, if it's a male, okay, you also need to check for the scrotum, the rugae, okay, the urethra, where there is, you talk about the epispadiasis, okay, you talk about that, and where the how the scrotum is. Okay, so that's about the genitalia. Okay, so from here now you can turn the baby like this. Okay, we are checking the back here. So now what are you checking here on the back? So here we are checking about, we are looking at spinal bifida. Is there a spinal cord which is protruding here? Okay, that's spinal bifida. So all those you need to take note. Okay, so that's what you are looking for at the back of the baby. Okay, so now like I mentioned, now this is a very long procedure. You cannot be asked to perform this whole procedure in 5 minutes. So there are things that have left that you are supposed to do. For example, the reflexes. You also need to talk about the reflex. So there are about 7 reflexes. Okay, you can come closer. So now I'll show you how to test for those reflexes. So the first reflex is the rooting reflex. So the rooting reflex, you can touch here. Okay, you can touch here, so you'll be able to see the baby's head. For those babies that are mature babies, you'll be able to see that the baby will be following where the finger is. So you can check for the rooting reflex like this. This baby will turn the head going this side. If you do it like this, this baby will be able to turn the head to this side. So that's about the rooting reflex. Then we also have the suckling reflex, where you get the finger, you put in the baby's mouth. So you'll be able to feel that this baby is able to suck. So that's the suckling reflex. Then we also have the palmar or grasping reflex. So for the palmar or grasping reflex, you can put your finger like this. So you'll be able to feel that this baby is trying to hold the finger. Okay, so we've talked about 3 reflexes so far: the rooting reflex, we also talked about the suckling reflex, and the palmar or grasping reflex. Then when you come to the legs here, we have the Babinski reflex, where when you do this, the leg of the baby, or the baby, will be able to fold the leg, like they want to grasp the leg, they want to hold the hand. So you do it from here. This is the Babinski reflex. So there are about 7. There are a lot of reflexes that you need to note when you are dealing with the baby. Okay, then you also have to check for the anal area here. Okay, where you can use this finger. You can try like you want to go in using the anal area using the finger. Okay, so you want to check if the anal area is open or closed. So you can use this finger and try to like you are going in. Okay, so this is about physical examination. So it is a very long procedure. We cannot exhaust everything. So most of the times, when you are doing this procedure, you need to prepare, you need to check for the vital signs that are going to act as the baseline data. Okay, so most of the time we are not going to do the temperature. We're going to do the temperature of the baby afterwards when you are done doing the procedure. Okay, because most of the time babies are irritative. Okay, when you want to try to do temperature. So basically, this is how you perform physical examination. You start with the head. So on the head here, like I mentioned earlier on, this soft spot, which is the blegma here, it forms a diamond shape. Okay, this form here, this soft spot here that is on the occipital here, the occipital fontanelle, it forms a triangular shape. Okay, so you need to know, are these bones overlapping, are they overriding, or are they paused? Okay, you need to know, is there cephalohematoma there, is there caput sarcidenum there? You need to note all those things. Okay, are there extra digits on this baby? Okay, all those you need to check. Are the hands symmetrical? Is that discharge? So normally this is how we do physical examination of a newborn baby. It's a clean procedure. You just need to know what you're supposed to do, and make sure that you don't expose the baby for hypothermia. Okay, all right, thank you so much. Keep following. Next procedure, we're going to do napkin changing. Keep following. Thank you.